My first guest this evening is Dr. Ramon Thomas, a gynecologist with Baptist Health, and Jessica Schorck. And you know, when we talk about gynecologists, we talk, we think about pap smears and babies, but you do a lot more than that.
Yes, sir. First of all, thanks, Dr. Fox, for having us on your show. We consider ourselves, as diverse as taking care of the whole woman, meaning from teenage years all the way to death, and their entire health parameters. So we want to make sure that we're covering everything that, any complaint that a woman may have, be it her, her prenatal care and any issues she may have with it, as well as any issues she may have when she's not pregnant. Say, for example, abnormal bleeding, breast issues, pelvic pain, things along those lines to help make sure that we can take care of her, from top to bottom.
And one of the things that I hear about, and some of the women I take care of had a lot of problem, and you deal with, is bladder dysfunction. And Jessica, you see some of that?
We see a lot of that, actually. I think it's one of those things that women don't talk about around the dinner table. Sometimes they're embarrassed to talk about, and a lot of times they open up about that problem to us during that annual visit.
Well, Dr. Thomas, what kind of symptoms are the bladder? I mean, we hear anything from pain to infection to loss of control.
Mostly it's the issue of loss of control, also the issue of urgency. You'll hear a lot of, I cough, I laugh, I sneeze, I leak, or you may hear, Doc, I got to go, I've got to go right now, or I may leak again. So it's a variety of things that we see. We also hear patients will complain that they go to the bathroom an inordinate number of times per day. So, as well as waking up in the middle of the night to go to the restroom. So there's a variety of symptoms that we have to kind of ferret through to figure out what type of urinary dysfunction that they do have.
Well, Jessica, when you hear some of these complaints, do you do nothing? Do you do medicines? Do you do exercise, or all the above?
Sometimes all of the above. We always try to pinpoint the problem as best we can based on symptoms alone, and sometimes we get a pretty good answer and we can start management. If it's kind of stress incontinence issues, we can start them on Kegel exercises and pelvic floor retraining. If it's an urgency, that gotta go problem, sometimes they're a candidate for medication. If we can't pinpoint it exactly, or if there's a combination going on, sometimes we have to do other testing.
Now, there's some medicines for the urgency, the frequency, the overactive bladder.
Right, yes, sir. The most common class is the anticholinergics, the Vesicare, Detrol, those types of drugs that will help strengthen bladder contractility, as well as help control the urgency symptoms that can help keep a patient from suddenly having to go to the bathroom, being able to go, sit down, empty their bladder without having the fear of loss of urine.
Okay, so we talked a little bit about medicines, and they all potentially have side effects. So let's say you've gone through the exercise, you've gone through the medicine. There's a new thing called InterStim out that you do to help pacemaker of the bladder, for lack of a better term.
That's actually a great way to describe it. What we find is that for certain patients with, say, urgency type symptoms, where they're I've got to go, RO leak, the overactive bladder, that are failing the conservative therapies like medicines, we start to try to think about, could this problem be less of a bladder issue than more of a nerve issue? And that's where the InterStim comes into play. The InterStim, like you said, is, as you described, is like a pacemaker for the bladder. It's very similar in size and in shape. And what we do is we use this device. Well, we actually do some testing first with an external type of battery to determine if your symptoms are nerve related. It's a simple in-office test, takes about 10 minutes to do, and then you do a bladder diary for the next week. If you notice 50% or more decrease in your symptoms, then that suggests that is a nerve-based problem and that the InterStim might be right for you.
Okay, let's get that up there so we can say, I mean, it's little, that's implantable, and that's a stimulator.
Yes, sir.
Helps control the bladder.
Yes, sir. Actually, not only the bladder, but for women who actually have fecal incontinence as well. So it has dual functionality, so women who are losing bowel function as well as bladder function, this can definitely be a game changer for them.
It's great information. Thank you for coming in.
Thank you.